Hey, Demetria Davenport here, the massage doctor. Welcome to the Massage Doctor Podcast. Here we have Dr. Barry Bird. He is a graduate of Kent State University of Podiatric Medicine, and he completed his residency at Weiss Memorial Hospital, and he has his license in the state of Illinois. Welcome, Dr. Bird, to the Massage Doctor Show. Thank you so much for taking time out your day to be here with us today. I greatly appreciate it. Could you give our viewers a little bit background about yourself and how you got started in being a podiatrist doctor?
Well, hello everyone. I'm glad to be here, and to answer your question, I started with podiatry specifically not like a lot of people. You know, they have that story where it's like, hey, when I was 10, I broke my ankle, and
Right.
a podiatrist fixed it, and now I wanted to be a podiatrist. I've always wanted to do medicine. I was always into science, and I was just pre-med in general when I went to undergrad. And it was a process, process getting into medical school, going through the process of applying and things like that.
Okay.
And me and one of my friends from undergrad, we both went to college together, grad school together, and we were both trying to get into medical school. And although I knew what podiatry was, I didn't understand that it was a different school for podiatry. And in the process of trying to get in, she applied for podiatry school and was trying to get me to do it too. And I really didn't understand that part. So once she got in, she was able to really give me a breakdown of what podiatry was. It had a lot of the things that I was looking for as far as medicine and opportunities. And then I kind of it was a head decision more so than like I've always wanted to do podiatry.
Okay.
So it was always medicine and, of course, the helping people portion of it. But the actual podiatry as a choice came through just a bunch of decisions and opportunities that were presented to me.
All right, that's awesome. And could you let people know the benefits of going to see a podiatrist? Because mainly when you hear people say they're going to the podiatrist, you think of elderly people, and or you think of someone who has diabetes.
Absolutely. So it's just like you would go to any other profession, because we are the professionals, we'll find things that you just kind of looked over, like, oh, I've had this mole on my foot for 10 years, and, you didn't know anything about it, whereas I may look at it with a different eye because I'm looking for a carcinoma versus a mole versus a wart versus, all those things that you could possibly have on your foot at the time. But it's very important. I had a conversation today with the lady. She was interested in having her mother be seen. And then in the second breath, she's like, oh, I'm a diabetic too, so maybe I'll come, when I'm a little older. And what I explained to her is it doesn't hurt to go even early just to have a foot exam because, something can be found that you wouldn't think to find. And then, at that point, you and your doctor can decide if it's something that needs to be followed on a regular basis, annually, 6 months, that type of thing.
Yeah, I totally agree because my specialty is foot care. Well, how I find my niche as a massage therapist, I had chronic plantar fasciitis. So, I went to the podiatrist, got the cortisone shots, had a cast. I was in calling it a cam worker then, but they call it it's an air boot. They're calling it an air boot now. I was on crutches, a walker. I did it all, but I ended up having to have shockwave therapy, and that was intense because I had to have 6 injections in my foot to numb my foot, and it was $750 for one treatment. So that helped, but prior to that, I was doing other things because the cortisone shots didn't work for me. When I did get cast and stay off my foot, it worked. But as soon as I went back to my daily activities, that pain came right back. It came right back. So that's how I found my niche in foot pain as a massage therapist. And I found my niche because I was doing things to myself to help alleviate the pain, but just working every day and going through day-to-day, my day-to-day daily activities, I kept worsening my foot because every time I took a step, I started, I felt a pluck in the middle of my foot was my plantar fascia. I felt a pluck. And so I told my podiatrist at the time what was going on, and he told me every time I took a step, that was my plantar fascia tearing every time I took a step. And then I even got a little bit of drop foot.
Oh, wow.
Yeah. So I was going into work one day. I was working at Chrysler, and I was going into work, and I would propel my foot to come forward, and my right foot toes scraped the ground. I said, "What in the darn tarnation just happened?" I thought I ripped my toes off. And so, anywho, I said, "What is going on?" So when I went into work, assessed my feet, made sure, it wasn't no bad cuts or anything. Thank God it wasn't, because I had to change and put on my steel toe shoes. And I was just like, what is going on? So I said, well, maybe I did something wrong, but I had to literally mentally tell myself every time I took a step, pick up your right foot. Pick up your right foot. Pick up your right foot. And I was just like, I never experienced anything like that before in life. And a lot of people don't understand that your feet are your foundation of your body. So if you're building a house and you have a not solid foundation, the house eventually, when it starts shifting and selling, you're really going to have some major issues, major foundation issues and everything else.
Absolutely.
So I tell my clients when they're coming in, the importance of their feet, or when someone contacts me and let me know they're having some issues with their feet. And now that I'm shadowing you at your practice, I'm giving everyone your card as well too.
I appreciate that.
You're very welcome. You're very welcome, because I let individuals know, go see a podiatrist. If you don't have one, here's a card. I know Dr. Bird. Like you stated earlier, it's good to have your feet checked out, even if you're not having any issues.
Right.
It's the importance of that. And again, like I said, people think it's just for old folks or people that's diabetics, but is it good for anyone that's dancers, athletes, and people who are just working on their feet at the plants, or nurses, our first responders? Is it good for them to come and get their feet checked out as well?
Absolutely. It's good to have your feet checked out. Sometimes people have a symptom that they don't even think is a real symptom. And something as simple as soreness on a daily basis or pain on a daily basis. And although that pain in itself may not be anything serious at that time, the eye of the podiatrist would know what that could lead to. Here's a prime example. When you're talking about your heel pain, sometimes people will tell you symptoms that let you know that it's early plantar fasciitis. And then based off of your story, where it could lead to.
Yep.
So just because you have a little soreness and you ignore it, the podiatrist may tell you, hey, I want you to try these inserts. So we'll get ahead of that pain before it becomes something chronic that requires, more extensive time, more extensive money, more extensive investment in your health, when you could be investing in your life somewhere else. So,
Right.
surgeries and shockwave and all that, you don't want to have to do all of that if you could have did something simple like change your shoe gear, for a few weeks before and move forward that way.
Now, what is the importance of anyone that is having some kind of issues with their feet, the importance of switching out their shoes and also using those inserts, those preventative measures to help with their foot health?
Yeah, preventative measures are such as inserts and shoe gear. That's like the very first thing you want to do, especially if you have a job, living in Michigan, Detroit area, you have a lot of factory workers, and all of them come with the same type of complaint with the plantar fasciitis or ankle pain from, overuse. And a lot of people, you ask, have you treated it with anything at home? Yeah, I bought, some good shoes. And you'll ask them, well, how long ago did you get these shoes? And they go, I got them 6 months ago, which for me wouldn't be that bad. But if I'm on my feet all day on, hard surfaces and things like that, you may need to change those shoes every 3 months or 4 months, depending on what type of work you do. And so a lot of times people don't think about those aspects. And even just me looking at your shoe and go, okay, I can see a wear pattern on here that although you got these 4 months ago, it may be time to get another pair. So that's like something that's an easy fix, and I think that's a good investment.
Yep, and then, like you said, the tread of their shoe, it's like the tread on your tires.
Exactly.
People will keep driving on their tires, and then we get some snow here in Michigan or a good rainfall, right?
Right,
you slipping and sliding all over the road.
Right.
You know what I'm saying? So, yeah. And then, what are some other foot conditions people can be aware of?
So, yeah, some of the most common things we see aside from like plantar fasciitis or Achilles tendonitis, basically Achilles tendonitis is just like kind of plantar fascia as well, but there is an inflammation of where the Achilles connects to the back of the heel. So sometimes you may walk and have that sharp burning pain in the back or a tightness. Another very common is ingrown toenails. A lot of times, especially on the first toenails, can happen on any toenail, but a lot of times on that first toenail, you'll get that big nail kind of growing down in the corners, and that can be sore. It can be painful. Some other risk factors with that, though, depending on if you're diabetic or other things like that, can lead down a bigger path of infection and such. So sometimes people can go, oh, I'll just trim it out myself. And even if you're healthy, you may get it out that time. But if you don't get everything out of there, you can leave an area for infection, abscess, and things like that. Saw that yesterday, actually. A healthy guy, he didn't get it all out. So that's something you would look for as an ingrown nail. Very common to see warts. Warts tend to be on the bottom of the foot. They can be painful. They can be transmitted to other family members and, things like that. Another common one is tinea pedis or athlete's foot, itching, wet web spaces, flaky, dry skin, redness, things like that. Those are like some of the big, quick ones that the average healthy person will come in and say, hey, what is this? Aside from an ankle fracture or something like that.
Something like that.
Yeah.
Okay. And I know it was a couple of weeks ago, I showed you was down at the office.
Yes.
A young lady had went and got a pedicure at a nail spa, and the nail technician had, no, not a doctor, a nail technician went and tried to extract that ingrown toenail out of her big toe, and it ended up turning into an infection, and the young lady had to go to the podiatrist and get it pulled out. She didn't pull out, guys, not just the doctor. He didn't pull out just one. He pulled out two ingrown toenails. The first one was it was small, but it was big, small. And then the next one, the doctor pulled out the second one. I was like, that's a whole nother nail. I was like, wow, but she ended up getting an infection with that. So what would you tell the viewers when they're going to these nail salons, nail spas, or foot spas, or whatever? Should they allow that person to do that? Because it's not a manicurist's scope of practice. Because I am a licensed manicurist as well, and it's not in our scope of practice to do anything like that.
Right.
Even if I know if one of my clients come in, I know they are diabetic, and I know their toenails are long. I'm like, when was the last time you went to the podiatrist? They're like, I went 6 weeks ago. I went a month ago, whatever. I'm like, okay, I'll let them know. I cannot cut your toenails. I'm going to file them down, so it may take a little bit longer, but I'm going to file them down to a nice length because I don't want to cut them.
Right.
And then I cause some kind of bacteria to get up in there and it just start mutating to something else.
Gotcha. Yeah, I would say it's very important to understand that with ingrown nails, they can start off, pretty benign, but they can really, go left. Like the one you showed me the other day. So when thinking about ingrown nails, you can have one that's just a little bit of pain and you kind of trim the nail out of the corner, and if you clip it and it feels fine. But if it's something that happens all the time, you should come to the specialist and let them look at it, especially if you develop symptoms of infection such as redness, red streaks,
Or some weeping.
Yeah, weeping, pus, and increased pain over time that's not getting better. Actually, it may be getting worse. Just because of that situation right there, because even if you don't have an infection, that nail, once it breaks the skin and, any kind of bacteria can get in there and it just allows it to stay. Another thing people forget about is it's not a lot of skin around the toe. And so once you go so deep, you're at bone. And what you don't want is for an ingrown nail to turn into osteomyelitis or a bone infection, which can happen, and I've seen it a few times. So, and in that situation, how we saw that lady, I don't know if she had osteo, but the type of infection she had could have easily turned into that. So, yeah, you want to be very careful with any type of situation where you have infection. Infection should always be treated by someone with a license and who can, if the person can't write you an antibiotic, they probably shouldn't treat it. Think about it like that. Yeah.
That's very good.
Yeah.
Yeah, because like you and I, we were talking. I said the nail tech, she didn't know if the lady was on a blood thinner, if she was a diabetic. If she was on a blood thinner, she should have bled and probably had to go to emergency or have 911 called.
Absolutely.
So they can stop the bleeding. And then also, if she was a diabetic and that little germ got up in there, like I said, you said if they can't write a script for it, don't do it. But just say her doctor did write her a script because she did have an infection. Let's say he did write her a script for antibiotics to get rid of the infection. Even with it's being treated, that little germ get up in that little in your system and just wreak havoc. And then if she was diabetic, it could have turned into
Septic is what you mean, like get
septic.
into the bloodstream and kind of get into all the organs and any other hardware you may have in your body. It could get bad.
Yeah, and then amputation if it get gangrene.
Absolutely.
Now, could you tell people a little bit about gangrene and how they get started?
Sure.
What individuals and how it can just really progress?
So gangrene is basically a symptom of peripheral arterial disease, and that's just basically, very quickly the arterial flow brings like oxygen down to the tissues and make them stay pink and healthy and give them the nutrients they need. Once those tissues use all of that up, it sends it back up in the veins. Okay, so when you have poor arterial disease, poor arterial flow, that means that those tissues aren't getting the nutrition, they're not getting the oxygen, and all those things they need to stay alive. And that tissue slowly dies, and it starts to develop what we call gangrene. That's that dark, dusky look. Toes become purple sometime, or white, or very cold. That's like the early stages, and it starts to turn black. The tissues can get like very hard and solid, and basically looks like a corpse.
It does because when I worked as a phlebotomist at the hospital, I had to go and draw blood from a patient that was in the hospital. So I got off the elevator, and as I'm coming up the hallway, I'm like, "What is that smell?"
Oh yeah.
I'm like, "What is that smell?" I'm like, "It freaking smells like death."
It does,
And
especially if it's wet gangrene.
So as I got closer to the room, and I'm just like, "Oh my God!" I looked at my sheet. I'm like, "This is the room I gotta go into." I went in there, and the individual, their feet were exposed. First thing my eyes seen was that black, purple foot. It did have some, when you have pus and it started crusting up a little bit.
Okay.
I seen some of that. I was just like, oh my God, I had never, ever seen anything like that. It's like somebody took somebody's foot and put it in some fire.
And just burned it.
And burned it.
Yeah.
Really, really bad. I was like, wow. So it was a guy, the gentleman, he was waiting because they had to amputate his foot. And then in the process of that, he ended up being a diabetic. He stepped on a nail or something, thought he cleared it up, did some alcohol, some peroxide at home, blah, blah, blah. And
didn't do a good job at getting that infection
out. And then it spread it to his toes first. Then it went to his foot. It started turning black. His toes started turning black. I guess it happened kind of quick. Then his foot. They cut him off at his ankle. And then the gangrene kept spreading. They ended up cutting him at his knee. And then it stopped. But they told him if it didn't stop at his hip, the hip as far as they could go. If it went past the hip, then it's into your internal organs. And they said you're dead because it's spreading into your organs. I was just like, wow. Gangrene is a bad, watch your mouth. I was like, oh my God.
Yes, it is.
But you just don't know how germs can just mutate and how fast they can travel and what kind of damage that they can do.
Absolutely.
Now, would you now kids are about to go back to school, playing sports. Would you recommend parents bringing their children in to get their athletes? Their children who are athletic, to have them come in and get their feet checked?
Yeah, that's a good idea. A lot of times with kids, they're gonna have pain anyway. If they're athletes and if their growth plates are still open, in the bone there's a growth plate that's there that fuses when we become adults, and then we don't grow anymore. And a lot of times they can have pain with the growth plates. They can have pain just from being overactive. Or just being, active in general. Maybe they're wearing the wrong shoes, that type of thing. So what you'd like to know is with your young kid, is that pain normal? Is it growth? Is it growing pains like we talk about? Because you can have pain in the bone from that. And then sometimes you can have like these transverse little fractures across those growth plates. And you would want to know that as well. Now, is that in every patient? No. But
Okay.
here's the thing: if you do damage a growth plate and it decides to fuse early, then now you have one side longer than the other, that type of thing. Now that's kind of the worst case scenario. But in general, what I look for with patients that are young and they come in with their parents and they're very active, I ask questions. First of all, do you have pain? Where do you have pain? And I look for those areas. Of course, the plantar fascia is always one of the main ones. The
Correct.
Achilles tendon, sometimes in the ankle joint or the subtalar joint, if they have a very flat foot or a very flexible foot. All of those things we look at, and we try to find a plan to conservatively get ahead of that, because at the end of the day, any pain, any issues that we have with our bones and our joints, we're all going to get it if we live long enough. If you get trauma to that joint, you get arthritis early. If you took care of them all your life, you're going to get it later, but you're going to get it, right? So with kids, especially if they're active, you want to protect them from getting any joint damage, any growth plate damage, and so that they can walk normal. So one thing I like to do is sometimes get them in some type of insert inside of their shoe, arch support, to better support those soft tissues like the plantar fascia, or to better align those bones, subtalar joint, ankle joint, that type of thing.
Good.
Yeah.
And a lot of people don't know too, like you said, with plantar fasciitis, you get those heel spurs. And I told everybody, I said, they're a couple. They go together.
They go together.
They married.
They married.
Either you get the heel spur, or you get the plantar fascia, or you get the plantar fascia, then you get the heel spur. I said, you can't have one without the other. They go together. And then also, like you stated as well too, that the Achilles tendon comes down to the heel of the foot. But and a lot of people don't know the Achilles tendon. They think it's just that little gristle that's on the back of your ankle. It actually goes up your leg. It's a thick tendon. It starts in the middle of your calf, and as it comes down, it narrows. It narrows down, and then it comes underneath the heel of your foot and meet with the plantar fascia.
Exactly.
A lot of people don't know that.
They connect at the bottom like that.
And they connect at the bottom like that as well. Like I tell people too, when they're having Achilles tendonitis or plantar fasciitis issues or whatever, I let them know, okay, I'm going to massage your gastrocnemius soleus, and I'm going to work on your plantar fascia tendon. And they be like, oh, down in my bottom of my ankle? No, it's in the middle of your calf muscle. I let them know as well too. I hit their hamstrings and their glutes, because all of that is connected. So I have
posterior chain, all of that is connected.
So I have to work that stuff out so the other stuff can work as well too. And like you said too, a lot of people don't know, if you're having foot issues, that means your ankle is off, your knee is off, your hip is off, your low back is off, and it goes all the way up to your mid back, and it can just keep going up. And
it can even go up and cause a headache.
Exactly, that's what I was about to say. It can go up and cause a headache because you got all this tension pulling, and then for example, I had my issue with my plantar fascia on my right foot. So people don't know, when you're in pain in your joints, especially if you're walking, your brain sends a message to your body, hey, Demetria is having problems with her right foot. Shift all her body weight to that left side. And we don't know it because God has just made us so uniquely. We don't realize
He did.
that all this weight is being shifted over to the other side, because then my left hip started hurting. I was like, I'm too freaking young for this. I'm like, what in the H-E double hockey stick is going on? I'm just like, oh my God. But a lot of people don't realize that. So I let them know when they come in to me and they're experiencing plantar fasciitis or Achilles tendonitis. I said, are you having problems on the opposite side? Is your hip hurting? Blah, blah, blah. They be like, yeah, it is. I said, because your body is telling your weight to go to the other side. We just don't know it. It just say, go over there. She having an issue over here. We need to relieve this pressure off this area. This is where she's having pain at.
Yeah, we call that compensation pain.
It's compensating. The other side is compensating. Now it's carrying all the weight on one side. On one side.
Absolutely.
Yep. So it was one more question. Oh, I want to talk about, a lot of people don't know about Deion Sanders. I've been doing my research on him or whatever, and I first came across his story at the beginning of this year because they said he had to get another toe amputated. So I was like, oh my God. I was like, prime time? He's a diabetic? And I was like, let me read this article, like I like him or whatever, and I love his story. And he ended up he has some blockage. He's not diabetic.
Okay.
He ended up having some blockage. His blood is not flowing the way it's supposed to. And a lot of people don't know when you're not getting enough oxygenated blood to those cells in your body, that part of the body, wherever part of the body is not getting enough oxygenated blood, that part of the body started dying off.
Right.
And that's what started happening. First, he said he didn't have any feeling in the bottom of his foot, bottom of his foot. He didn't have any feeling. And then, like I said, those tissues weren't getting enough oxygenated blood to him, and his big toe started turning colors. So they had to amputate it. Then they had to end up amputating the toe next to the big toe. I was just like, oh my God. But he's not getting enough circulation. So I know they said they had to, you have 3 arteries in your leg. You have your femoral artery, your iliac artery,
Yep.
and you have your popliteal artery.
Yep.
And I don't know which 3 they had to reroute, but he only has 1 artery that's working because they had to disconnect. I'm going to say disconnect. They had to disconnect 2 of the other arteries, and a lot of people don't know like that. Femoral artery, my sister-in-law, she woke up one day. She was having some achy legs because she works at the plant. So I worked on her. She came in for some treatments. It worked for her, but she was having some issues, so they became more achier. So she went to one of the vascular vein centers. She went to one of those places and went to one place, and the doctor was telling her that, oh, yeah, it's here for femoral artery. He said, oh, what it's not doing, the blood is going down. So I guess, correct me if I'm wrong, Dr. Bird, the blood, that's the artery. I think is that blood coming from the lung to push it back up to the heart, or vice versa?
So it's coming down and it's going back up to the lungs.
Okay, so it's coming down from the heart and going back up to the lungs.
Right.
Well, he told her that, oh, it's just, I'm going to say stagnant. That ain't the word he said, but I'm going to say stagnant. Oh, it's just a little stagnant. It's not giving you that extra push to transfer the blood back up to the lung. It's nothing to worry about. And I told my sister-in-law, I said, you better go find you another you-know-what doctor. I said, because I said, make it make sense. I said, that don't make sense. If it's responsible for sending the blood back up to your lung, you got to get that proper exchange from the lung to the heart. Everything works together.
Right,
so if it's not pushing it enough blood to go back up to the heart, I told her, I said, what is your heart doing? And then she ended up having 2 big bruises on her leg. One was on the side of her thigh, and then the other one was on the back of her thigh at her popliteus, in the back of her knee. And I'm looking like, no. I told her, I said, girl, I said, that's your check engine light coming on. Your body telling you, okay, look here. And I gave you some warnings, so now the light is on for real.
Right.
And she had 2 bruises that was about this big on her legs. But she ended up getting the surgery done. She went to another place, and they did fix the issue for her.
And that's a good place to just kind of stop and say, whenever you're getting like bruises and things like that, it could be something simple. It can be, but if you're constantly getting or you don't remember doing any kind of damage, it's wise to get it checked out, because vascular issues can turn on a dime. It can be as simple as a clot move and block more of a vessel that had flow at first, and now it doesn't. Something just move because the vessels are large and they get smaller. So that item may be in a larger vessel, and you're just fine, and then it moves down and boom, it just blocks a smaller vessel, and it happens quickly. So yeah, you don't want to ignore like bruising and things like that.
Right, because doing my research with Deion Sanders, they were saying like you have the bigger vessel that's coming down, and as it's coming down, you go down to the smaller vessels.
Yep.
You get that blockage, and then now you have blood clots. I know because I know he's on blood thinners as well.
Okay, yep.
And his injury, where my notes at now? His injury happened. What did he do? He's had 11 surgeries on his legs for this, and I think he ended up fracturing a toe or something. Something happened. He fractured a toe or something.
And then it became.
And they said, oh, It's nothing, but it was in his earlier years, and as he got more mature, this was
it
the
turned
cause.
into that.
It turned into this.
Okay. Yeah.
Yeah. I was just like, wow. But I heard that from some guys I know that played college, that played football. They was like, I know one of my friends, he still has back issues. Like he can do something, it might turn a certain way, and then he just pause and be like, I'm like, what's wrong with you? He's like, I can't move.
Yeah.
I'm just like, wow. So he explained to me when he was playing football, he got hit. And, they take you off the field, and the coaches and whoever the teams is on the sideline to get you back together, get you back in the game. So, it's okay, you're good.
Yeah.
I know some athletes that's going through stuff like that now.
Yeah.
Or whatever. They're just machinery. They just go out there, play the game, but then in the long run, as they get more mature, they end up having issues. Because I had one client come in, and he was having issues picking up his leg to put in the car. And I was like, wow, and I think that was that sartorius muscle is responsible for lifting your leg up, and also you doing the Indian, when you cross your legs like the Indians or whatever, it was responsible for that as well, and also responsible for propelling your leg forward or whatever. And that was something from an injury that happened when he was playing. He was playing professional football.
Yeah.
And I was just like,
because a lot like we were talking earlier, I was just saying some of the joints, you damage them, and then over time, everybody's going to develop some type of arthritis. So just, how much you wore your joint out. So with people who are professional athletes, they've done a lot of wear and tear on those joints. And so, they'll develop that stenosis of the joint or that thinning of the joint sooner, which pinches nerves, which affects mobility, which affects muscle firing, and all of that stuff is just connected like that. Yep.
Yeah. Wow.
I have a question.
Go ahead, Doug.
Producer Doug here. We were just talking, or you guys were talking about people who are pretty active athletes and nurses and people who walk around a lot.
Right.
What if a person is bedbound and, over time, like for instance, my wife, she's been she has MS, and she's been bedbound for 7 years or so, right? And what has started to happen is her left foot is starting to turn inward. Now, is that dealing with is a huge effect of the MS, or is it just her not being active, keeping her foot from functioning as it should be properly functioning?
I would say that's more so from the MS, because the thing that you would look for more, and I'll just speak from the podiatric standpoint, I would be more so worried about pressure ulcers on the heels and things like that. So with the MS, that's a neurological situation there, and so when you have issues with any kind of nerve conduction, sometimes you can have something called clonus, and what that is it's a misfire of the nerves, and it'll make those nerves make the muscles pull. And so if her foot is turning in, it could be a particular muscle that's getting a different type of firing. Or the other one is not getting enough and it's weak. And so one side overpowers the other and it turns the foot in. A lot of times what you can do for a situation like that, I wouldn't say in her case if she's not, trying to get up and move, but for some people they may have, for whatever reason, if they have a perineal nerve damage and their foot is turning or something like that, sometimes you may put them in a bracing type situation just to kind of help that muscle compensate for being overpowered, or other one from being underpowered. For some people, you may do like some type of joint fusion where you actually take the joint and you turn it into a solid bone, so the foot sits in a situation where it can walk and bear weight, but it just doesn't have all the range of motion, but it's still functional. You know what I mean? And you don't have to wear the bracing and things like that. But I would definitely say that was more of a neurological, the MS causing that foot to kind of turn in like that.
Yeah. So there's no hope really to reversing that, other than the nerve issues with MS.
Yes. Now, like I said, structurally, if you were ready to put it in a brace or something like that to kind of hold the foot straight so that it can be, walked on and that type of thing. But then your next question is, how viable is that? Is that even necessary
as an option?
Point? Yeah.
No, it isn't. Okay. Yeah. Okay. I was wondering about that because Demetria, we were talking about that.
We were talking about that earlier.
Yeah.
Yeah, and I was telling him just from me being a nursing assistant, one of my other tools in my toolkit. I was telling him when people that's bed bound. One of the clients I worked with, he was a closed head injury individual, and I was telling him when your body is not being used, some people go into, they call it the fetal position, because everything goes back up into the fetal position, and then it's another one. I don't know the name of it, where their lower part of the lower extremities just go stiff.
Okay.
Or whatever. It's a name for it. I just don't remember.
I mean,
I don't know the name
spastic,
for it.
but I don't know what the actual, because I think it's a few things can cause that. Yeah, but that symptom is like spasm or spastic. They're kind of tight.
And they're just tight and they just
Yeah.
move. Cause I know during the pandemic, because in my industry, they shut us all down. So I ended up going back into the medical field, and I worked at a head injury place.
Okay.
And it was a gentleman that was like that there. He was in a he got hit by a car and his head hit the ground or something. So he had ended up having a head injury, and he was fetal here, but then his
Straight down
his
at the
straight his lower extremity, it was just straight or whatever. I was just like, wow.
Yeah. And I won't pretend to be a neurologist either, but that's kind of the overarching, thing. That sounds definitely like a neurological change or symptom. Yep.
Yeah.
You know, and it's to my wife's situation. Some years ago, her legs just stuck out straight. And then the next phase of it is they retracted in. And they were like, Demetria.
The fetal?
Yeah, she went, there you go. And her arms are like that to this day, right?
Yeah.
And she has in her abdominal cavity what is called a baclofen endothelial pump, right? And that is attached to her spine, which gives her the baclofen, which keeps her legs from drawing back up. But I'm noticing now the legs are straight. She's unable to move them, but it's like I've noticed that spasticity issue is starting to kick in. And when I felt her calves on her left leg where that foot is turning in.
Yeah, it's tight.
Yeah, very. And so, I think we were just wondering if there was some kind of a treatment or procedure that can be done, but basically it's therapeutic. We just have to.
It's therapeutic. I mean, so sometimes if you can, if when you know what muscle it is, you can go and like lance the nerve sometime, and that'll just make it limp.
We were talking about doing that for her arms.
Okay.
Because she's unable to use them.
Yeah.
Right. So, and she had an actual, an abrasion. The skin breakdown in the fold of the arm, right?
Yeah.
I mean, it was.
You
Moisture.
can't treat it in there. Yeah.
Yeah.
Oh, it's hard.
Because it's tight.
Oh, it was. Look, I noticed that my son said, "Dad, what's this smell?" And I started sniffing around, and I went right to the fold of her arm, and I saw her ligament. I saw muscle tissue, and I was like, "Shazam!"
Yeah.
So yeah, it's what you guys do is amazing to me.
Yeah, I think in that particular situation, that's something you would want to do because you want to get in there to clean that wound and let it heal up. You don't want a wound open to ligaments and muscles showing. Cause can lead to other things.
She's been getting treated for that for like the past year.
Okay.
And it's never completely healed. We just have to make sure it's
what happens, that moisture getting in those folds or whatever. So that's why it's important to make sure that the facility is keeping it clean, and or if someone like the client I took care of, his people had enough money for him to be at home or whatever. But you still, because their hands are going to do the same thing too. You have to make sure their nails are trimmed because their nails will start digging into the palm of their hands. And then we used to roll up washcloths.
Yeah, like the carrot, like they stick through the
Yeah,
through
and
the
you
hand.
take it and put it in there to hold it to stop them from digging, their nails digging into their palm of their hand because they'll dig right into the flesh. Yeah, and the same thing with the fold of their knees as well too. That moisture just gets there.
Now,
or
is there
whatever.
anything like that can happen with the toes that'll call them to clench in like that? And
with
is there
the
anything?
toes, Yep. The toes. So anything that has a muscle and tendon connect can essentially do that. What we normally deal with is not so much. Well, It can be neurological, but it's called hammer toe, basically. And you have a contracture of the toes. A lot of times you can treat that by releasing a tendon,
So now hammer toe, that's something, it's quite popular.
Yeah.
What does it look like?
It's like her hair. It's like jacked up.
Yeah, so like the toe is supposed to be flat, and you got this joint, that joint, and that joint, and they kind of bend like
Being
that.
like that.
And when you walk, they can want to grab the floor as opposed to lay flat.
Wow.
Or someone gets in their hand, they call it trigger finger.
Wow.
Yeah.
Wow. So people who wear flip-flops, does that promote that kind of thing? Because they're
Not
always okay.
Not necessarily. It can if, any kind of ill-fitting shoe can cause you to have a muscle imbalance. But usually for hammer toe, it's usually either a muscle imbalance, a nerve, or there is like some kind of joint, arthritis or something going along with that. Yeah.
Wow.
It's usually structural.
Now, Dr. Bird, I know podiatrists go into the nursing home facilities, but I know they're calling them rehab,
Long-term care.
long-term care, or rehabilitation centers now, whatever.
Right.
So when you all go in there, normally they address the individuals who are mobile, who are diabetic, or just want their toenails trimmed. Would you recommend that for someone that is bedbound?
Absolutely. When I go to the nursing homes, I see patients that are bedbound as well as the ones that can walk and everything in between.
Okay.
And, largely what the facilities want you to do is basically give an exam of the foot and keep the nails trimmed. And something as simple as that, it really cuts down, incidents of people not coming out, whether it be from infection or like we talked about the ingrown,
Yes.
things like that, or just the comfort, A lot of the patients, they see me come in and they're glad. Like, I need my nails trimmed because we know how it is. If nails get too long, they hurt.
Right.
But especially even with bedbound patients, sometimes you'll look at those pressure points that we talked about. What are your heels looking like? Let's get ahead of this because we don't want a pressure ulcer to start
Yep.
on that heel. And then you're thinking about that coupled with other things they may have, such as diabetes, or if they have peripheral arterial disease, it's going to be accelerated. Because basically, even if you have good blood flow, all the pressure ulcer is ischemic changes,
Yep.
As if you didn't have blood flow, because it's just pushing the blood out of those tissues. They would otherwise get the nutrients
to it.
but because of that pressure, that tissue dies,
Yep.
So a lot of times people miss those type of things. And it's not that the nurses don't know, but sometimes they get really focused on the pushing of the medication and the things up above, and they kind of miss the things on the feet. So what I notice, I guess the thing that I speak to a lot is, comfort and just catching things early. Yeah, I don't end up having to do too many like serious procedures, because usually it's people that are, elderly and they're not really running marathons anymore or having to work a shift. It's just more for palliative care. But we will have to take a patient in sometimes and do an ingrown nail procedure, or if they have a bad one, we may have to have them go to the hospital for like an OR debridement or something like that. But other than that, that's kind of what we speak to there, making sure they got diabetic shoes, looking to see if their edema is controlled from their venous stasis, venous insufficiency, that type of thing. So.
Yeah, because that was going to be my next question. Okay. But you talked about that, about the pressure ulcer. And if it came into the cubic ulcer, that's what a pressure ulcer is.
The cubitus, yep.
So when it happens, guys, that skin dies because, like Dr. Bird said, there's no nutritionist blood getting to that area. So when it starts getting really bad, that's when that debridement comes in, and the doctor has to come in and with a scalpel, and I've seen it, they cut down to the
good tissue.
The good tissue.
Yeah.
And when I seen that, I was like, oh my God, because my client that was homebound and his family paid for him to come in, they paid out their pocket for it. He had one on his hip, on his right hip, and they had to go in and debride it, even though we were turning him every hour.
Yeah.
But still, all we were doing, it still wasn't enough. That skin, we never kept them wet, because a lot of people don't know too. If you have someone that's in a nursing home, and if they're incontinent, if they're pooping and peeing on themselves, that bacteria eats through that skin, and then it turns into the cubic ulcers and all that thing, and then you have to come in with that debridement. But he had a pressure ulcer, and they had to come and debride it. I could not believe it. I started crying. My boss was like, "You okay?" I said, "I don't like what they doing to him." But she said they have to, whatever. And when I went in and seen it after they got done. I got myself together. I seen it. It was amazing because when you're in school and nursing assistant school, they talk about the 3 layers of skin and blah blah blah. When you actually see them, I was like, oh my God, this is real time stuff. You really see the 3 layers of skin, and then from there, then you start going to the muscle, then tendon, and then it's to the bone after that, whatever. But it was amazing just to see that.
Yeah, a lot of times people will look at a debridement, and I get that in office, especially when family members come in with the patient with ulcer, and they go, "Oh, you're making it worse," and you have to explain to them, one. Anything that's not alive needs to come off.
Yeah.
And no matter what it looks like at the end, it has to come off or it never heal. And then 2, blood you want it to bleed, because blood shows that it has potential to heal. And it's like, oh, he's bleeding. Well, that's what we want.
Yeah.
We want to get all the bad stuff off, and we want to make sure that it bleeds because all those things promote healing.
All right, well, Dr. Bird, thank you so much for coming on the Massage Doctor podcast. I greatly appreciate you taking time out your day to come and share with us and the viewers the importance of coming to see the podiatrist. Thank you so much. I greatly appreciate you.
Thank you. I had a good time.
And get ready. You're going to be my co-host, so get ready because I think people need to be educated about foot health because that's something that's not being talked about. And I've come across a lot of people that's experiencing that lower extremity pain with their legs and their feet.
Well, I look forward to it.
Well, thank you so much.
You're welcome.
All righty. Well, this is the Massage Dr. Demetria Davenport. This is the end of our show. So see you on the next episode. Mwah. Love you. Bye.